We may feel detached from the experiences of those living so far away, but the virus very much affects the UK too. According to the latest statistics from Public Health England, it's estimated 98,400 people live in the UK with HIV, and of these, 22,000 are unaware of the infection. There's a growing number of outlets of support, and I went along to one in London to see for myself the help offered. What are the programs you offer here?
NANS Project London is providing primary and secondary prevention. The primary prevention with a target and objective of having people to come for early HIV testing. In order to do that, the most important thing is the outreach service. The outreach service is just using staffs and volunteers by just hitting the street and then providing and distributing leaflets and information. But we are providing other primary preventions. Can I show you around? The most important are for example, people are coming for HIV testing, where they are coming here in the office and just do a 30 minutes of HIV testing of a blood. They will know their results and then they'll just have their own case, and then if they are just positive, we'll just refer them to hospitals. The other is training. Training is provided for frontline organizations who are really working in the HIV sector, or for volunteers, depending on the knowledge, attitude, behaviors, and then information, how to live with it. All that kind of training is just delivered for organizations or individuals in workshops and seminars. The other most important thing is counseling.
And why is counseling so important?
As you know, the impact and the effect of HIV, who are affected and unaffected by HIV, has got psychological, social, emotional, and then cultural effects. In order to do that, they're just coming here, and then our counselor is just giving them according to their needs, which is a very important how to deal and live with it positively.
And what is meant by secondary prevention?
Secondary prevention is the same thing like primary, but the difference is secondary prevention focus on care and support service, particularly for those who are already having the HIV virus in their blood, which means once they have got the virus inside, they are going to focus how to live with it, how are they going to live with the medication, how the self-management, and then how they are going to live with their partners. For example, their partners might not be HIV positive, but in the meantime, they are just living positively, and they will be responsible for themselves and the community at large. That is secondary prevention, so that at the same time we are giving them care and support service other than the HIV issues.
And do you offer these services to everyone?
We are just offering services for different BME communities living in the United Kingdom, which means South Asians, Latin Americans, Africans, Middle Easterns, so that we are just delivering that with a specific, tailored, culturally, religiously appropriate kind of services by the motto of one size cannot fit all. So that we are just delivering it for everybody, but in their own kind of language and culture, specifically tailored for their own need.
Quite often, HIV is seen as a medical issue, but it's very much a social one too. And for many, it's difficult to be open about their condition due to cultural taboos and stigma. Living with HIV. Can you tell me about your experience?
Well, my experience of living with HIV has been a life-changing experience. The experience of accepting that I got the virus, and also accepting that I have to take my medicine every single day in order to fight with the virus. The information was there, and I didn't care about it, because I thought it's not going to be with me. But now, my experience has been a learning curve, I know I will have to face discrimination in the future, or probably in my work environment, and also the experience of being able to tell other people about my personal situation and the facts that we have to face of living with HIV.
What was the reaction from your family and friends and community at large?
To be honest, I was really, really scared to face discrimination, bullying, and rejection. But in the other hand, my family and the group of friends that I decided to tell my status, they've been really supportive.
What are your coping mechanisms living with HIV?
Well, my coping mechanism is to be aware that I have to take my treatment every day. It's the routine of taking my tablets and also the routine of dealing with the tablets when I'm on my own, when I'm with a good group of friends who knows my status, or when I have to hide my tablets with the other group who doesn't know my status. So it's really a bit tough situation because, you know, I always will be scared of being discriminated or bullied because I'm HIV.
And people who are diagnosed with HIV positive these days, still many think that it's a death sentence. But clearly you're living proof that it's not.
I know, well, it's a stigma for the people who used to deal in the past with friends or relatives who were HIV positive. You know, before treatment wasn't available, all the medical service didn't have enough resources or they were not aware of the virus. But now everything is available. The medicines, the specialists, and the care from the hospitals, you know, when they know your status, and also from friends and family. So I hope we will live longer than they used to predict.
So how's your life now? Are you in a good place?
Oh, my life has been fantastic now. Before I have to deal with all the stigma, all the discrimination issues, all the taboos inside my life. So at the moment, my life is fantastic because my treatment is working well. I'm coping with the situation and having good friends and family, friends who are supporting me.
Negative social responses remain widespread even in seriously infected communities, resulting in harmful impact on public health and human rights. How do we break the silence? A good example of this can be seen in Senegal, a country with strong religious beliefs where it was decided that HIV should no longer be a taboo and must be openly discussed. Now, religious leaders in Senegalese mosques speak openly about the virus and ways of protection. We asked Betty McConey, CEO of Child Girl Network, why the issue of this virus isn't openly discussed in certain faith groups.
People associate HIV infection with one mode of transmission, that is through sexual contact. And then in a church circle, that tends to be immoral for you to have sex outside marriage. And even if you are a wife who has been infected, you also try to protect the integrity of your marriage and your husband. So if you look at the majority of those who go to church, they are actually people who are always classified as morally right. So to a larger extent, they felt it's not a subject they could discuss so openly.
In the UK, this subject remains a taboo amongst many communities. I spoke about this to Asif Qureshi at NAS Project London. So what are some of the challenges you've come across in trying to raise awareness within different communities, cultural communities?
Sexual health and HIV just isn't talked about in black and minority ethnic communities. Now, I work predominantly with the South Asian communities, so I'm dealing with people from Muslim backgrounds, Hindu backgrounds, Sikh backgrounds, etc., etc. Sexual health, HIV, there are not words in our languages, in Urdu, Punjabi, Gujarati, you name it, there's not words specifically for HIV and sexual health. So there are many challenges culturally, linguistically and religiously in dealing with sexual health and HIV.
And how successful do you think you've been in getting the message across into these different faith groups and different communities?
We've been very successful. I mean, we've been going now for 21 years and predominantly a lot of our work stemmed from the South Asian communities. We've done kind of poster campaigns. We've worked directly with the communities in London. We've worked in communities back home in India as well with help from the NAS Foundation India. So we've been very successful in getting the messages across and getting people tested and also working with faith leaders in particular in getting into the mosques and the temples in order to get those messages across.
HIV is no longer regarded as a death sentence due to the availability of antiretroviral therapies. These are effective in fighting the virus and its complications, helping the majority of HIV patients taking them survive at least a decade. Scientists are continuing to take new approaches to combat HIV, and research is being done to find a vaccine to produce a sufficient defense against the virus. Preventative programs and initiatives are also in place, aiming to reduce barriers to early diagnosis of the infection. Progression has been made on many different levels, medical, social and political. But is our biggest challenge to hold on to what we've already achieved? What's the future for HIV/AIDS globally?
There are a lot of people who doesn't know what the transmission is and how it's affecting and how we are going to approach it. So knowledge and education and then changing of behavior, attitude is the most important thing.
We don't only eliminate stigma through laws, we eliminate stigma through group counseling when people come to accept the disease as part of who they are and the fact that they can have a mature approach to it. So we do not only eliminate stigma through laws, we also eliminate stigma through principles and values.
To make testing readily available to everybody without fear or consequences of going for a test or the result. Prevention programs, making sure the whole population and the people in government and who make policies make condoms available and make it clear how people can prevent them getting HIV. Also crucially is that treatments for those who are infected are readily available, particularly in the developing world.
HIV is not a case of them and us. It's a virus that doesn't discriminate irrespective of sexuality, age, gender, culture or religion. As we move forward into the third decade since AIDS was identified, there's still no cure and challenges remain. However, opportunities do present themselves too, with changing social attitudes and longer life expectancy as a result of extraordinary advancements in treatment and prevention and global access to medicines. The fight continues to combat this deadly disease.